Ladies and gentlemen, welcome back to the channel. I'm Dr. Dawson, and in today's video, we are going to talk about the 5 most common causes of arthritis in dogs. In my last video, we talked about the pathogenesis, the technical side of arthritis, but in today's video, we're talking about specific diseases and specific joints that develop arthritis and why in dogs. Let's get started. Probably the #1 cause of arthritis in dogs is a either diseased or injured cranial cruciate ligament. Now, the cranial cruciate ligament, or the CCL, is also the ACL in humans. So if you know anybody who's had an ACL tear, this is the same ligament. And basically this ligament prevents the tibia, that bottom part of the leg, from sliding forward in relation to the femur. So if you have your knee here, it prevents this bottom bone from sliding forward. Now, the other thing that it does is it prevents hyperextension. Hyperextension is when you basically have your joint, which looks like this, it's your knee, and it prevents it from flexing or extending too far, past 180 degrees. The other thing is it prevents rotation of the tibia. And all of these things, as you can imagine, if there's an injury or if the ligament is ruptured or not, meaning it broke, you can imagine this could cause massive instability in the joint. And so a dog that has an injury or a ruptured cranial cruciate ligament actually is very, very prone to developing arthritis in that joint, and it'll actually scar down, and we can get some pretty severe joint disease, especially as they age. So what causes an injury or damage to this ligament? Well, part of it could be sports or some sort of activity. This is definitely one of the main causes that we see, especially in younger dogs. In older dogs that develop this, part of it can be very much related to obesity. The more weight a dog carries, the more strain there is on these tiny little ligaments, and the more likely they are to break or tear under pressure. With cranial cruciate ligament tears, we also see a variety of dogs, but very specific breeds that are more prone to developing this. Any dog could have a cranial cruciate ligament tear, but these breeds are way overrepresented. There's way more of them than in a lot of our other breeds. And so these include your pretty common breeds such as Labrador Retrievers, Newfoundlands, Boxers, Rottweilers, Pit Bulls, English Bulldogs, and there are more to that list as well, but those are probably the most common ones related to that. One other condition can actually be the medially luxating patella, and this is where the kneecap slides to the inside of the knee and is no longer sitting in the groove that it's intended to sit in. Now, when this happens, it's much more likely to be a hereditary or a genetic reason that they have a medially luxating patella. But when the patella and that whole ligament, the ligament attaching to the top and bottom, are not there holding the knee in place, you lose stability, and this puts more strain on the cruciate ligament, leading to more likely to have tears or injuries. Now, the next one is hip dysplasia. Now, hip dysplasia is a mostly hereditary disease in which the ball and the socket of the joint do not fit as closely together as they should. So either the socket is a lot shallower, so instead of it being a nice deep round socket, it's very shallow. As well as the head of the femur. Sometimes we see changes to that where it's been flattened. Rather than being a nice perfect sphere, it's actually very flattened. And between these two, it allows more separation between the two parts of the joint. And this instability can lead to some very severe arthritis in dogs. If you guys are breeding dogs or you're thinking about breeding dogs, make sure that you guys get breeding dogs that have very good hips. And getting them OFA'd or certified is a very good way to prevent passing on genes that are going to cause hip dysplasia in the future. The next joint and joint disease that we're going to talk about is elbow dysplasia. So the elbow is made up of 3 different bones: the radius, the ulna, and the humerus. And they interact in a very unique way that we don't see in a lot of other parts of the body because we have actually 3 bones forming a singular joint. And it allows the elbow to rotate. So this is actually a movement of this joint, as well as flex and extend, while allowing stability of the whole arm or leg of a dog. Elbow dysplasia has quite a few different components that I'm not going to get into because there's so many different parts that can be slightly malformed, leading to disease during weight bearing or instability during weight bearing causing arthritis in the future. Now, one of the other things that we can see is actually trauma. So trauma is very common as well as when we're talking about damage to a ligament, damage to a tendon, damage to the joint surfaces. So you're talking about the cartilage between the joints, or even something like the meniscus. Any of these things can cause enough inflammation that we can get instability of the joint, leading to long-term arthritis. Now, the last one that we're gonna quickly mention is medially luxating patellas. And yes, I already talked about it. But in small dogs, this is extremely common. Small breed dogs tend to have a very shallow trochlear groove, which is the groove where the patella or the kneecap sits. And so that kneecap likes to pop out of place. And when it's popped out of place, we get instability of the knee joint and can get severe arthritis in that joint as they age. Now, the one good thing for small dogs is that a lot of times they tend to be less weight bearing because people tend to hold them more and they don't have to walk on their own 2 feet or 4 feet all the time. People tend to just carry them around like a purse dog, you know, kind of thing. So that is one advantage. However, they definitely still can and do get arthritis in those joints. And as they age, it's something to watch out for. And it's something that if it's severe enough, very well should be corrected with surgery earlier in life. Thank you guys so much for watching this video. In the next video, we're going to talk about the top 5 myths related to arthritis in dogs. So stay tuned for that video. That'll be coming here pretty soon, as well as the next video after that, where we're gonna go deep into the management of arthritis in dogs as well. That's gonna be an interesting video. It'll be a little bit longer and a little more technical, but it should be still a fun video nonetheless. Have a fantastic rest of your day, guys. We'll see you in the next video.